when somebody comes in and maybe has an arthritic knee on x-rays, we might tell them, yes, your x-rays show enough arthritis, you're a candidate for knee replacement surgery, but we don't do surgery just because the x-rays show that. We do surgery because you feel that it's time. And there are some things that we can try short of surgery. And I would say most people are of a mindset that they would like to try other things first and keep surgery as the last resort. Not everyone. Some people do come in and say, you know what, I just want to get it fixed and move on. And that's okay too. I mean, it's just how you approach it. But those things that are short of surgery are generally divided into oral medications, injections, therapy, and bracing. That's kind of the 4 categories. So oral medications include primarily anti-inflammatories or so-called arthritis medicines. These obviously have been around a long time. They are available over the counter in 2 different medications. One is ibuprofen or Advil or Motrin, all the same thing, ibuprofen. And the other is Aleve, which the generic name for that is naproxen. So those are both over the counter. They're both anti-inflammatories. Now, normally you can take that kind of sporadically, so just on an as-needed basis, and you'll get some relief. But if you really want to get an anti-inflammatory benefit, you typically need to take one of those medications on a regular basis and sort of keep it in your system all the time to keep that inflammation down. That's kind of hard to do with ibuprofen because it only lasts for about 4 hours. So even if you're taking those large doses, which sometimes I see people taking 800 milligrams 3 times a day, I don't really know that you're getting complete coverage to where you always have your anti-inflammatory working for you. Aleve will work that way. So Aleve or naproxen lasts about 12 hours. And so the strategy with that is to take it morning and evening about 12 hours apart. And to do that on a regular basis, and if you do that, then you'll have that in your system and you can actually bring that inflammation down. And in doing that, it may take 4 or 5 days before you reach that full benefit. So you don't necessarily notice it on the first day, you'll notice it after 4 or 5 days. Now, when you're taking your anti-inflammatory, and there are also, I should mention, prescription anti-inflammatories as well, and oftentimes those will only be 1 dose a day, so they're a little more convenient. And to be honest, they're actually not that expensive anymore because they've all gone generic now. But when you're taking your anti-inflammatory, whether it's over the counter or prescription, you may have breakthrough pain. So you may be going to bed at night and you feel like you need something extra to help you sleep, or you may have a headache when you're taking an anti-inflammatory and you wonder what you can take for that, or just other aches and pains. That's when you can take Tylenol. So Tylenol is not an anti-inflammatory. It works in a different fashion. It's cleared through your liver, not through your kidneys, which most anti-inflammatories are cleared through your kidneys. So it's compatible that way. You're not going to overload the kidney or the liver. And there's really no benefit to taking that on a regular basis. You just take that on an if and when basis. So if you're taking, for instance, Aleve and you have a headache and you want to take something, it's fine to take some Tylenol. You also want to make sure you don't overdo the Tylenol. The maximum dose is on the bottle. But if you're taking extra strength Tylenol, which is 500 milligrams, the most common dose, you want to stay under 6 of those per day.